Medicines save lives and improve quality of life, but medications need to be carefully managed, especially for people with multiple diseases or conditions. Problems can arise if a person is being prescribed medications from several doctors, or if they don't have access to needed medications, or if they aren't taking their medications as directed. Pharmacists practicing as part of a patient's care team can have an enormous impact on improving patient care. This model of medical practice is referred to as clinical pharmacy services, or CPS. CPS is a health science discipline in which pharmacists provide direct patient care and other medication management services. Acumentra Health, Oregon's Medicare Quality Improvement Organization, is a leader in helping Oregon health systems improve medication safety. As part of the Oregon Medication Safety Project, Acumentra Health created a medication safety database and a technical assistance program to support the integration of clinical pharmacists into the patient care team. 11 clinical pharmacists working in 17 clinics are participating in this quality improvement project aimed at identifying and addressing medication-related problems. The database is helping these pharmacists look at medication safety data consistently and comprehensively.
If those potential adverse drug events or adverse drug events are identified, we often can resolve them at our visit. So if it's something that's under our protocol, then they're resolved at the visit. If it's not life-threatening, if it's something that we've identified that has the potential to cause harm at some future point in time, then we will send a note to the primary care provider and schedule a follow-up. So the patient has a plan to come back in to resolve some of the medication-related problems that we've identified. Where I think the database helps is thinking about the spectrum of medication-related problems that might occur in a given patient encounter, and to really put the emphasis on the safety of the medications that we use. I think from a clinical standpoint, I think much more about how my decisions or how my or the lack of therapy can affect patients, and how I can either help that, like in those visits or coordinating with providers to address the medication-related problems that we identify. So I think I'm much more careful about thinking comprehensively about the patient's care and the safety of their therapy, knowing that there's a lot of different medication-related problems I need to be on the lookout for.
Acumentra Health's medication safety program and database is increasing the quantity and quality of available patient safety data and helping clinical pharmacists work at the top of their clinical training. The results: better patient care, improved patient safety, and lower healthcare costs. Learn more about Acumentra Health's Medication Safety Project by visiting our website.